At the end of 2023, when the whole year was wrapping up, an article published in the Journal of the American Medical Association really started making some waves, and it's grown, of course, as the new year 2024 has come upon us, and many people are starting to look at their emails. They're starting to share more things. They've kind of gotten past the new year. And so this article is really building upon a lot of exposure that's happening over the last little bit. And that article is very interesting because it's actually a published study. And the published study talks about the differences between hospitals that are owned by private equity-backed companies and those that are not. And what they ultimately discovered was that there was an increase, about a 25% increase in hospital-acquired conditions. So even things like central line-associated bloodstream infections and falls had greater than a 25% increase. And that's a big deal. And it's easy to just get caught up in the numbers. But if you look at the individual, anytime, these should be a zero incident issue. Falls should not happen. It's very, very hard in healthcare facilities to prevent falls for a number of reasons, whether it's medications, whether it's delirium, whatever the condition is. There are certain things that are just very difficult to prevent. However, we should be working to make it zero. And so it's really easy to get caught up in the numbers and the statistics. But ultimately, if you put a face to these, if we have 100 people that are getting hospital-acquired conditions, and then you think 100 of those individual people, those are families, those are friends, those are loved ones of people. Nobody wants a hospital-acquired condition. And then to think of the fact that if they were to arrive at a facility owned by a private equity-backed firm, they have a 25% greater risk of that. That is very, very astounding, and it's very concerning. Now, the opposite side to this conversation is also that there are some facilities that have struggled, especially during the COVID-19 pandemic, financially. And so more and more of these companies have come in to try to save these hospitals, to provide care in areas that are lesser served, care for hospitals that were individually owned, and now they're owned in a consortium of hospitals, so they're able to make purchases better. They're able to get lower pricing on things because there's a larger amount of facilities under this one umbrella. So of course, the flip side to that conversation is that they are trying to do some good in these communities where it's very difficult, and they're looking at ways in which they can improve that care, but ultimately there's a lot of business decisions that are being made. And so the ultimate purpose of this video is to get your thoughts and your comments on business leaders running healthcare organizations. And that's been a big topic for a long time, many, many years. And healthcare has had this fracture, this division between business leaders and between those that understand healthcare. And it's really, really important that healthcare providers are at the table of business decisions, and vice versa. Business leaders that are working in administration and healthcare and don't understand the clinical component really need to, and they need to be more actively involved in leadership rounding. They need to be more actively involved in huddles within departments and things. And so bridging that gap is important. And I think a study like this shows even more that when there's areas that are focusing on saving money, on saving facilities, on being able to consolidate payments and do things to earn money off of healthcare, it also makes you wonder and makes you consider the fact of ultimately what's happening. At the end of the day, a healthcare facility is about caring for the individual in the bed, the individual that's walking in the door needing medical care. And if that's not the center of the conversation, then any of these facilities, whether they're private equity backed or not, really need to consider what are they doing and what is their actual focus, mission, vision, and values when it comes to caring for individuals. So leave your thoughts in the comment. I'm going to link the article right here below this video so that you can read the actual journal article. You can go through the statistics and the data yourself with the comparison of the facilities and how they used some of the publicly reported Medicare information to be able to make the comparison. Very interesting. If you want to know more about it, feel free to read the entire article. Thank you for watching this video. If you want to see more videos like it, make sure that you like and subscribe. I appreciate you joining.